So I'm going to step back a little bit from the sales and talk about the territory that I get rather more involved in. Some of you will know I tend to hide away at the hospital and would be rarely seen at Tattersalls. But I wanted to talk about whether fall injuries and diseases compromise future sales and racing performance. In 1999, Wilshire, Allen and Wood, which I'm sure you all know is a Newmarket-based team, looked at a group of 1,022 foals, and they were also obviously interested in the reproductive aspects of their dams, but they followed what happened to these just over 1,000 foals as they went on into their racing lives. And the group that are of particular relevance to this presentation is they found that 6% of them died or were destroyed before the age of 2 years. And in that particular paper, they didn't really expand upon that. And I guess I thought that maybe 6% was rather a large number. One might sort of intuitively guess that the larger proportion of those losses will be very early in life. And the best study that has been done in recent years looking at neonatal illnesses has come from the University of Florida, which has a very long-standing history of being leaders in the field of perinatology. And Steve Shigar and his colleagues there reviewed, again, a little over 1,000 foals admitted to the intensive care unit, and showed that if you look at this table, you can see comparing the 80s, the 90s, and the noughties, there's been a very satisfying increase of survival, right, just under 60% in the 80s, then 70%, and now 80% of foals admitted to NICUs can be expected to survive. The common problems there in the US are sepsis, neonatal infection, diarrhea, pneumonia, which arguably are sort of part of infection, dysmaturity and encephalopathy. And the overall survival was just over 70%. If we look at the foals that are admitted to the Peter Rossdale foal unit, then we have a similar spectrum of diseases, but slightly different prevalences. So our number one reason for admission is what I would nowadays call neonatal maladjustment syndrome, also known as dummy foals, barkers, which are sort of descriptive terms of what these foals are doing, so showing neurologic signs. Peter actually coined the phrase second day syndrome, which really is a description of the fact that often these foals will be normal at birth, and then over the first subsequent 12, 24 hours, then they begin to decline. Earlier in my career, I would have called this perinatal asphyxia syndrome or hypoxic ischemic encephalopathy. And those are terms that describe what are one potential cause of this problem. But it's clear that this is a multifactorial problem, or rather there are probably multiple routes into the same endpoint. So lack of oxygen, whether that's in utero in the last few days of gestation, or possibly as a result of compromise that's more acute in nature during a dystocia, can certainly compromise not only the oxygen levels, but also the whole circulation of the foal. But more recent work, much of it coming out of California, has shown that in there are complex changes in progestogens and hormone balance in the foal as it transitions from fetal life into perinatal and then natal life, and alteration in that balance can lead to neurologic signs. So we think of neonatal maladjustment syndrome, as was illustrated. I decided not to play the video for too long because it is kind of a bit distressing to watch, the poor thing. But basically this foal is showing seizure activity. He's still able to stand, but they will have variable degrees of neurologic function. But very often there's also renal compromise and intestinal dysfunction, and in its most extreme form, neonatal maladjustment syndrome will lead to multiple organ dysfunction. Second for us, and actually number one for the Florida group, is neonatal sepsis. So infection, usually bacterial infection, that might be acquired in the late stages of gestation, getting into the foal via the placenta, or in the foal once it's born, perhaps due to failure of passive transfer. Neonatal infection can localize into one body system, so there might be just pneumonia or enteritis or umbilical infection. But again, it can lead to that same point, which is multiple organ failure. In the very young foal that gets neonatal sepsis, there's also often multi-joint involvement. And the thing is, really, from a clinical perspective, they look pretty much the same, actually, or at least the ones that get into in the intensive care world look pretty much the same. And they're managed largely the same way, which is to support their various body systems and differentiated based on laboratory findings. And then the third important group is prematurity or dysmaturity, lack of maturity, which is often a component of other illnesses, but the key things we'll be looking at, we'll often x-ray the foal's limbs early on, because if you get this sort of picture, which is essentially lack of ossification of the cuboidal bones, externally that limb will look normal, but if you let that foal walk around, then it's going to lead to compromise, and so it's likely to have a significant impact on its athletic performance. And then more acutely, if the lungs are not mature, then that is very challenging. Some of these foals may be okay on a ventilator, and recently, actually, for milder cases, we're getting a lot of success with a high flow respiratory system, but prematurity obviously is a big challenge. Then there's a whole bunch of other things. Miscellaneous congenital abnormalities, such as up here we've got a foal that has a very abnormal heart. We will see the occasional donkey, and usually in the slightly older foal group, we'll see things like colic. And another big group are the musculoskeletal conformation abnormalities. So when we look at our foals overall, I pulled out the records from 06 to 16, found 442 foals, 339 of which were thoroughbreds. The survival rate overall is about 75%, and it's no different for the thoroughbreds. When you split them into 5 big groups, the ones that stand out as having a poor prognosis are those with prematurity and dysmaturity. So to get back to the question I'm trying to address, do foal injuries compromise sales and racing performance? The best study that's been done in this area came from Ireland. Dr. Kevin Cawley, who many of you will know, did an excellent study where he reviewed foals that had been treated in his hospital and compared them to compared them to other foals at the same sales, and essentially found that there was no difference in the mean sales price whether it was a foal that had been hospitalized or not. So certainly from my perspective, that's useful and very encouraging information. I have tried to look at our foals, and I spent a lot of time this weekend doing this, and the longer the weekend went on, the more and more sort of committed I was to the route that I had chosen, and increasingly began to wish I'd done it the way Kevin did. But what I did was our nurses have actually been collecting this data for years, so we've got information about we get it from the Racing Post. We know the sales prices if the foals have been presented for sale. So I picked the first sale that animal had encountered, assuming that the person who's paying our bill is the one who's selling it. So that might be full yearling or 2-year-old sales. And then I subtracted the costs of, obviously this is a bit of a rough and ready sort of thing, but we have the costs of the intensive care and rearing costs. So jumping straight to the chase, what does it actually cost to have a foal in the NICU? Well, I was actually quite surprised, shocked even, that the median is way too low. The median price, you can see it there, and that's the interquartile range. So 50% of the foals are in that band, just under £3,500. We'd just give you a couple of caveats. One thing is that once the foal is dead, we can't continue to generate a bill. So oftentimes the lower bills are the ones that are the short-term survivors. And then clearly there's a very wide spread, but those are that's the data as I found it. for rearing costs, actually Jenny Hall helped me a lot with this, but I used the TBA economic impact study and looked at the various estimates they gave there, and I chose the most favourable one from my study perspective, the book 3 price. And I would just point out at this point that includes a £5,000 stud fee. But of course, I was somewhat on my own when looking at other sales, so I decided just to half that for foal sales and add a bit on for 2-year-old sales. So these are very rough figures. And if we step through our foals, you can see there were 339, I think I said that already, 76% discharge, which leaves us 258 foals. 11 of those died within the first 6 months. So at least in theory, 247 reached potential sales age. A big chunk of these foals are not presented for sale, so 108 actually went to a sale. And then when I first took off the rearing fee, I'm afraid only 36% of sales were still in profit at that point. Once we take off the NICU fee, then a further 3 people are pushed in the wrong direction. So if you look on the different, at the different disease groupings, there's no significant differences here, but you can start to see, I think, by looking at the numbers, that the premature foals are perform poorly, as do foals that have musculoskeletal, neonatal musculoskeletal things, so severe conformational abnormalities. And of course, I mentioned already that that TBA study has a notional stallion nomination. So helpfully, I found on the McKeever St. Lawrence websites some actual nomination fees, and so I only did it for those that were in theory still in profit, this group here, but once you actually put in the proper nomination, the likelihood of profit drops again. However, do bear in mind that we have to see this in the context of the industry. So there's a quote there from the economic study: the estimated loss on an average thoroughbred at book 3 is £23,500. If we move on now and consider the racing performance, the best study that has been done in the United States using the same study population from Florida, they compared their case foals with siblings and found that there was a lower proportion of the foals overall that raced, and it could be largely attributed to the prematurity dysmaturity group and the orthopedic group. And looking at various performance indicators, those same things held true. But encouragingly, the other disease categories, the encephalopathy, the sepsis, and so forth, actually appear to have little impact on their racing performance. So if we look at our foals, again, we will jump in at the ones that were discharged, just over 250, reached racing potential. Of these, 61% raced. And of the foals that did race, then 65% were placed and 50% were winners. When we look at the different subgroupings, actually by a sort of statistical quirk, suddenly the premature foals are doing really well. 80% of those raced, but that's actually 80% of 5. So most of our premature foals have left the flow chart up at the earlier stages of their careers. So there's really, actually, in terms of whether they do or don't race, it's kind of across the board. There isn't much difference. Whereas when we look at performance measures, again, the differences are not significant because these data set is quite small, but actually, descriptively, by whichever measure you look at, again, prematurity and dysmaturity in orthopedic cases appear to achieve less than others. So here we have sort of lower numbers of winners, lower numbers of placed, lower earnings. So I thought it would be useful then to compare our British cases with the only data set we have, which is the Wiltshire study. When you consider the proportion that raced, being twink Alanies presented it sort of negatively, those that didn't race were 39% in twink study, which is actually identical to ours, but by 3-year-olds, of course, more of them have raced in twink study. So we're sort of there and thereabouts, perhaps not quite as good, but actually it would seem that being in the full unit makes you more likely to be a winner and more likely to be placed, so that's marvellous. Just a slight aside, really, we've had a particular interest in rib fractures for some time now, so Billy Fian, one of our stud vets, got the data from our hospital and also from Troy Town, and looked at outcomes for foals treated in a variety of ways for rib fractures, and found actually didn't really make a huge amount of difference how you treated them, but the outcomes for these foals in terms of racing and performance was fairly good if they survived the original problem. So we move on now to the weanling age group. I think it'd be no surprise to the people in this room, the things we think about here are largely associated with infections. So infectious respiratory disease is a big problem in this age group, GI diseases, and septic arthritis and physitis. And this is just a CT scan illustrating abscess in a physis in a foal. The largest study in relation to respiratory disease, I think what people might guess, and I'm often asked about this, is if it has pneumonia as a weanling, does that mean it's not going to make it as a racecourse? Actually, the published work would suggest the opposite. So there was a fairly large study done, 115 cases, including both standardbreds and thoroughbreds out of multiple institutes in the US. And in fact, the survivors, when they compared, the proportion doesn't seem that high, and it is quite an old study now, but when they compared that to the US racing population of the day, there was relatively little difference. We've done a little bit of work on that, along with a group from the University of Glasgow, led by Tim Parkins. He has a lot of expertise in using text mining techniques, where essentially using sophisticated software, you can take pretty much any form of record, whether that's a farm record or a medical record, and search for specific keywords. And using that approach, looking at 1,200 births over a 5-year period, we were able to find 56 pneumonia cases, and comparing the racing outcomes with those that did have pneumonia. Mostly these were weanlings, there were a few foals in there. And those that didn't have pneumonia, actually there's no significant difference. So I think that is definitely encouraging news, given that that's a common problem. And then turning our attention to GI diseases, there's less of information available here. But Lithonia is a condition I think that we were all very worried about a few years back, that now that more people are using vaccination, it's becoming a problem that we see less frequently. But the same situation would be true in Kentucky, I think. So back in the days when we weren't controlling it with vaccination, this study came from Kentucky, and they looked at actually sales outcomes rather than racing outcomes. But as you might predict, Lithonia is a condition that leads to very severe weight loss. And so these foals, when they're presented for sales, somewhat predictably are not going to do as well as their siblings. And septic arthritis in the weanling age group, we also have studied a bit, and myself along with Sarah Stoneham and Richard Payne and Louisa Smith, aided and largely controlled by Stuart Reid, looked at medical records of 69 thoroughbred foals. We found just under 85% discharged. But when you compared the foals with septic arthritis with 2 of their siblings, then the results were somewhat disappointing. arthritis foals not only were less likely to race, but they also took longer to start if they did race. So drawing all this together then, do foal injuries and diseases compromise sales and racing performance? Well, here are the sort of conclusions as much as we can draw them from what's available in the literature and also our own observations in our foal unit. There is a high wastage rate between birth and 2 years of age, and that warrants some more studies. Actually, the HBLB is funding a study that many of you will be aware of out of the Royal Veterinary College, looking in a bit more detail in this age group. In neonates, multi-organ dysfunction associated with maladjustment and sepsis are the commonest problems that we have to deal with here in the UK. And we know that neonatal illness does have a relatively high mortality, around 25%. However, if the foals do survive, then it has little impact on their likelihood of racing and the future sales performance, with the key exceptions being neonatal. And I would emphasize, I'm talking about neonatal orthopedic problems. We're going to go on and hear a lot more about orthopedic problems in the juvenile. These are foals that are having orthopedic problems at birth, essentially. And then prematurity and dysmaturity are going to impact on sales and racing. When moving into the weanling age group, encouragingly, pneumonia does not appear to have a negative impact on racing performance, whereas septic arthritis will impact on future in racing, and clearly any condition that causes significant weight loss and failure, I think we could predict will impact sales performance. And just in finishing, I would like to acknowledge, obviously, neonatal care takes a huge effort from large number of team members. So we've employed many nurses over the years under the leadership of Bonnie Miller, who you can see in the middle there. And there have been a number of vets who've worked in the NICU in the period that I've just reviewed. So Stacey Sullivan, Emily Haggett, and Niamh Collins and Imogen Common up the top there. And I should also acknowledge the inspiration of Peter Rossdale, who set the whole ball rolling for foals, I think, in our unit. Thank you very much for your attention.